Hi everyone and welcome. My name is Ken Vitale and welcome to this guide right here for preparing for a residency in physical medicine and rehab, PM&R. Whether you're just an MS1 maybe exploring the space, or if you're an MS4 that is actively applying in this cycle, I'm hoping that this presentation here serves as a little walkthrough in terms of the key steps and the strategies, and hopefully you'll get some insights to help you succeed in your residency application. So here we go. Let's get started with the timeline. So MS1 is all about exposure, right? Joining interest groups, attending local conferences in your region, and shadowing the PM&R physicians in your area. MS2 is when you start building those research, the mentorships, this time going to national conferences, broadening out from the local. MS3 is pretty critical. This is where you choose your PM&R electives early and apply for those all-important sub-Is. MS4 is, of course, the execution phase. This is where you do your away rotations, your ERAS, and your interviews. So I'm not sure where you are on this course, whether you're just an MS1 or an MS4, but just stop and think, right? What is the one step you're missing here? What have you not completed at each one of these stages that you can, well, one step you could take this month that could move you forward along this timeline. I do recall a very organized and proactive MS1 that started right then and there. They ended up writing a really compelling personal statement at MS4 year about a rehab patient that they remembered all the way back in MS1 year, and they tracked over time, and they started journaling. Each year they wrote down their experiences. That is huge, and I recommend that. Journal your journey in PM&R from MS1 to MS4 so you can get the most out of it and write a really good statement. Now, of course, the core rotations like medicine, surgery are essential, but neurology and orthopedics are absolutely paramount to PM&R. PM&R is essentially where neurology and orthopedics overlap, and those are core rotations that you must do. For electives, you can certainly consider EMG if you can find it at your institution. MSK radiology, very important. I found that incredibly useful. Pain and spine, if you're into that. Sports medicine and even a general trauma elective are useful. Many programs do value that exposure to these related specialties, even like rheumatology and orthopedics. So a stop and think question is, which elective do you think would best complement your interest in PM&R and why? Because that's the one you want to take, that's the one you can talk about on your interviews, and you can sound like you're very interesting and passionate about PM&R. I do recall a student that took a pain management elective and learned injection techniques way early in MS1 and MS2 that really impressed their attendings during their sub-I in MS4, and they were really prepared. For me, it was actually rheumatology. I found it fascinating. I thought it would be orthopedics and all the fractures and mechanical injuries that occur. I did like biomechanics, but I found the pathophysiology, which is really where rheumatology shines, to be absolutely fascinating, and I was able to talk their ears off, so to speak, during the interviews about that, and that was very valuable for me. So find your elective passion. Of course, letters matter. You want to work closely with your PM&R faculty and ask early, ideally right at the end of the rotation when everything is fresh. The PM&R SLOE, S-L-O-E, Standardized Letter of Evaluation, is now strongly encouraged and really helps programs compare applicants fairly. That is really quickly taking over now. So what you want to think about in this stage is the qualities that you want your letter writers to highlight about you, which means you got to let that shine during your elective. One student, for example, in a recent elective, gave me a little short summary of their goals and their strengths, and then we can use that to put that in the letter, of course, and write a more powerful letter of recommendation. Now it's the SLOE, S-L-O-E, so you might want to read about that and learn about that, but that can help you match. Interview prep. Of course, you want to practice questions like, why PM&R? Describe a challenging rehab case. These are all classic questions to ask. Of course, know your CV and research inside and out. Prepare for questions on it. You are going to get asked. Sometimes there's going to be some deep dives on your CV, so don't write anything that you can't back up. Interviews, it's it's all about character and fit, not just knowledge and skills. Your CV talks about that. Your electives show what you've been exposed to. You want to show what kind of person you are. So the stop and think question here is, how would you answer, tell me about a memorable patient? That might kind of stop you in your tracks at first and you got to scramble and think about one. But if you've already prepared and have that ready, you can just hit them with that answer and be very successful. For example, like a student that might share a story about helping a stroke patient regain their independence, literally standing and walking down the hall with them next to the physical therapist, helping them along their journey. That story can really resonate deeply with your interview panel. So again, another little tidbit here. Journaling your story from MS1 through MS4 to have all those stories at the ready is going to be very valuable to you. Now, on to skills, right? By graduation, you certainly should be proficient in your neuro and MSK exams, things like basic rehab planning and treatment plans, and the basics of procedures like EMG and injections. Programs certainly value students who, how do you say this, think like a physiatrist, I guess, in a way, focusing on function and independence, not just diagnosis and treatment. So in this stop and think mode here, what skill right now do you feel most confident in that you can talk about on an interview? And what are you a little nervous for them to ask about, where you feel like, oh man, I really don't know EMG very well? Well, that might be a chance for you right now to start thinking about that, reading up on it, and improving it and getting some exposure. For example, sometimes a student is very good with the medical piece of things. They might know neurology and orthopedics inside and out, rheumatology very well, even radiology, but they really don't know therapy all that well because it's somewhat allied, ancillary health professions right next to PM&R, part and parcel with PM&R, but it isn't PM&R directly. That's physical therapy. But if you can shadow a physical therapist, an OT, a speech therapist, and find out more what they do, you can really impress the interview panel and the whole team with your, well, holistic approach. Student groups and organizations, of course, get involved with AAPM&R, AAP, even ACRM if you're into that. Presenting posters at conferences is a really great way to build your CV. Because this is showing, that you're interested. Leadership in interest groups also can signal, well, having some initiative and some passion too. So I'm not sure if you've looked into any specialty societies or conferences yet, but it can be a really valuable step in your PM&R journey. We had one student here a couple years ago who led their PM&R interest group and organized a whole rehab symposium at an AAPM&R meeting starting in medical school, and then switched over when they were in residency, kind of led the way and called me to kind of come to the conference. I didn't end up going. I'm sorry about that for the person that asked me, but it was really great to see that growth. So that's certainly going to catch the attention of a program director. In addition to getting involved in these organizations, there is a ton of online learning opportunities now. A lot of them are with AAPM&R, the online learning.aapm&r or PM&R Knowledge Now. Incredible resource. I wish I had that when I was a medical student, but these are great resources too that I encourage you to check out. Okay, and let's continue on with timelines. Say you're an MS3 already and you're really moving forward. Well, the spring of your MS3 years when you start to meet your advisors. The ARIS application, these dates change, but in general, they open up in June of your MS4 year when you're first starting. Applications are due in September. Interviews run from October through January, and of course, match day is typically in March. So that's your timeline, and you don't want to be late on it. So when you look at this timeline, I don't know if you're in MS4 right now, but I would say the stop and think question here is, what part of this timeline feels most intimidating and how can you prepare for it right now? I remember it, again, same thing. Similar student, this one's a different one, started their personal statement. They were really proactive very early, like in their MS3 year as they were going through their core rotations, and had a ton of time, a whole year, to start revising it with their mentors and their PM&R docs. And that really helped polish a final version that, well, it really stood out. That's being a little aggressive, maybe doing your personal statement a whole year early, but hey, if it gives you time to really work on it, more power to you. Now, in terms of matching into the more competitive programs, yeah, obviously strong letters and relevant research are important. Interpersonal skills are key. PM&R is in general, FYI, if you're a DO or an IMG, an international medical graduate, PM&R is very friendly, so to speak, to those applicants. But the bar is slowly rising. So these days, a mean Step 2 CK score is around 242 last I checked. Again, those numbers go up and down over time, but it is getting harder to get into the more competitive PM&R programs. So the thing you should ask yourself at this stage would be, well, can you think of one way you've already demonstrated a clear and full-on commitment to PM&R that you can demonstrate to let you shine in terms of a more competitive program? An example here might be a student who volunteered in an adaptive sports program. We have a lot of that here in San Diego, such as Challenged Athletes Foundation. You can use that experience to highlight your, obviously, dedication and commitment to the functional recovery process in a patient, and therefore you can be a shining physiatrist. Now, in terms of building your extracurriculars on your CV, you can certainly start easy at the top. Things like case reports, QI projects, and the like. If you are ready for more, you can explore some rehab tech, some sports recovery, maybe some disability advocacy. There's a lot of different ways you can go here with PM&R, which is really exciting. But the best extracurriculars are those that fully align with PM&R's mission. Things like function, independence, inclusion, team-based care, and things like that. So here, the question you should ask yourself is, what kind of research or volunteering truly excites you the most, and why? Because that's the only thing that you're actually going to follow through and do it. I didn't and currently still don't like research all that much, but if it was on a topic that I really liked, I would actually follow through and do it. So I encourage you to do the same. The example here is a student that might like Paralympics a lot, for example, and volunteer there, or adaptive sports or Special Olympics, or something that deeply resonates with them, and therefore it can deeply resonate on your personal statement and build that compelling narrative from MS1 through MS4 that connects all your experiences together and shows that you're clearly on a path of PM&R. Got to talk about interviews one more time just to really hone this in, because this is where you're going to shine. This is where you set yourself apart. Just be ready for those standard questions like, why PM&R? How do you handle setbacks? Please try to avoid cliches like, well, I like the lifestyle and things like that. Just focus on your passion for functional medicine and team-based care. So, for example, right, put you on the spot right now. How would you answer the question, describe a time you led a team? You might just stop and freeze and say, oh gosh, I didn't think about that question. So here's your chance to kind of prepare your interview questions, practice with your friends. Maybe a student could share a story about organizing a rehab workshop for their peers in medical school. That's a leadership example. It'll help you stand out in the interview. More often nowadays, programs are increasingly focusing on those behavioral questions like, tell me about a time when you disagreed with a team member and what came out of it. You might even want to consider learning that STAR method. I put a resource here from MIT. Situation, task, action, result. If you're kind of stuck and stumbling through your words trying to figure out an answer that sounds professional and organized, the STAR method may work for you. So, thanks for, I guess, joining me in this PM&R residency guide journey here. PM&R is certainly a specialty that is all about restoring function, improving lives of patients, and working as part of a compassionate interdisciplinary team. Now that you've gone through this presentation, think about, right, in all those slides, what's the one step you want to take this week that'll slowly move you along that journey, because it is many steps, and as they say, a journey of 1,000 steps just starts with one. I don't think that's exactly how that goes, but I think you get the point. PM&R is competitive, yes, and it is increasingly competitive, but it's also very welcoming to those who bring, well, authenticity and empathy to their patients and a very clear, compelling narrative from start to finish, MS1 to MS4. So I would recommend just to stay curious, stay committed, and don't hesitate to reach out to us for membership. Not membership, mentorship. We're here to support you. I'll end on that one.